Hello, everyone, and thank you so much for joining me today. I'm so happy and so proud to be a part of the Digital Dental Notes team with Dr. Jim Lozier and all of the great faculty. Welcome to the first installment of the Dental Drug Class of the Month. And today we're going to be talking about SSRIs, or selective serotonin reuptake inhibitors. This is just one of many classes in the overall category of central nervous system pharmacology we're going to be talking about. But I wanted to start with SSRIs because, gosh, they are so common. They're so widely prescribed. And one of the first things I wanted to talk about with you is that we tend to call these antidepressants, but we've got to be very careful because they're not only used for depression. SSRIs are prescribed for lots of things besides depression, anxiety, PMS, PMDD, OCD, PTSD. Well, that's a lot of acronyms, folks, but you get what I'm saying, right? So these drugs, SSRIs, are prescribed for so many different conditions. We can't always assume we know. And that's why I've always said, and if you hear me say this 1,000 times, it's never enough. Whenever you take a medical history for a patient, it's always the three questions, right? The first question is, what do you take? Second question is, why do you take it? And the third question is, did you take it today? Which is the question that never gets asked, right? But the what do you take? That's just exactly how you ask it, right? You don't use the word drug, you don't use the word medication because people are going to think, oh, little bottles I got from the pharmacy. No, you don't want that. You want everything. You want the drugs that they take, right? The prescription drugs, the over-the-counter drugs, dietary supplements, the substances. You want everything. So when you just ask a general question of what do you take, then you get everything, right? You get all the things you're looking for. And believe me when I tell you, folks, people don't want to tell you necessarily what their issues are, medical concerns and conditions and so on. But they're more than likely to tell you about the drugs they take. And that's fine with you. Why? Because pharmacology is the Rosetta Stone when it comes to the hieroglyphics of a patient's medical history. You may not know the whole story, but with the drugs alone, you can decipher a lot of their medical history and pretty much write the medical history yourself, but you still have to ask questions. And here's a good example of one reason why, because SSRIs are used for so many different things. A patient may tell you, well, I'm on Lexapro, but you have no idea why they're on it. So you have to ask them, what do you take? I take Lexapro. Why do you take it? And then, of course, did you take it today? These are, as I said, selective serotonin reuptake inhibitors. What is their job? It's to boost the level of serotonin in your brain slowly, methodically, by inhibiting the reuptake of serotonin by the synaptic vesicles at the synapse. Slowly but surely, over time, you will build more and more serotonin levels in your brain. Why do you keep saying slowly but surely? Because it's slow, because it takes like 6 to 8 weeks for SSRIs to really take their full effect. And that's one of the first points we have to talk about when it comes to therapeutics for these drugs. Pharmacology is easy, but the therapeutics is simply this. I finally reach out to my medical doctor or the prescriber that's going to be prescribing this drug for me, my healthcare professional, and they prescribe this Lexapro. Now, I've reached out to them because I'm depressed, I'm anxious, I'm seeking help. They prescribe Lexapro, Celexa, Prozac, Zoloft, all of the different SSRIs. And then they tell me I have to wait 6 to 8 weeks. That's 2 months. What am I going to do for the next 2 months? So you can see why that could be almost heartbreaking to a patient who's seeking help and not getting any immediate relief. And this is why it's estimated, never proven, but estimated that 20% of Americans who take SSRIs also take an over-the-counter supplement along with them, like St. John's wort, because they think they're going to get a faster response. However, while it takes 6 to 8 weeks to start working, once they start working, that's great. But if you miss a couple doses, the fall is precipitous because now you've lost all of that built-up serotonin, and it takes a long time to build it back up again. So that's another reason why we don't want people to stop taking the medications. If we can help it, we'd rather them keep taking it. And keep in mind also that when they're taking these medications, they're taking them because they have whatever that issue is. So we want to make sure that when we're treatment planning, we know a little bit more about it. So for example, if I'm anxious, if I have anxiety, you may want to put me in an operatory that's a little more on the quiet side, maybe down the hall from everything else, if you know what I mean, off the beaten path sort of, because it's quiet, it's more serene. You could talk to me in a very reassuring voice. maybe, help me with some other distractions, music, whatever, just to get my mind off it. Because let's face it, folks, a dental chair is one of the most stressful places you can find yourself, right? On the other hand, if I'm depressed, you may want to put me in a more lively operatory, where it's a little more action going on, more people walking around, talking and joking around and making conversation because it's going to lighten the mood. And maybe I'll talk to you in a more upbeat voice, and say, hey, okay, and sort of get that conversation going. Knowing about a patient's medical history is a lot like reading a novel, folks. You can read the lines, but unless you actually read the lines and merge them together into the novel that they are, you're never going to get the real meaning of the story. So, the first point is, the fact that they're used by lots of people. Second, that they take time to work. Third, they can be used for more than one thing, so find out why, right? And fourth, some people supplement with dietary supplements to get a greater effect or a faster effect. Okay, so we're boosting serotonin in the brain by inhibiting the reuptake, right? Lots of drugs are reuptake inhibitors, but SSRIs are in a class by themselves because they work on serotonin alone. Now, there are other related classes like SNRIs. Those are serotonin norepinephrine reuptake inhibitors like Cymbalta or Effexor, but they're going to be part of a whole different dental drug of the month, folks. So don't worry, we got plenty of drugs to talk about. There's so many dental drugs of the month. We're going to be here for about 10 years, but that's okay. All right. So now that we know that it can be used for multiple things, what is it that you need to know? See, that's an important part about pharmacology. Great, Tom. You tell me all these facts. Wonderful, but tell me what I need to know as the dental professional. What does it mean to me if my patient's taking one of these medications? Okay. First of all, realize that because these drugs take a while to start working, certain parts of the brain are turned on or stimulated before other parts of the brain are. And one part of the brain that gets more activity before the other parts do from taking these drugs are the areas of the brain that may make the patient think suicidal thoughts, suicidal ideation. And that, if that's not the biggest kick in the pants, folks, I don't know what is. You go to your healthcare professional, you reach out for help, you get prescribed this medication, you're told it takes 6 to 8 weeks to start working. But in the first couple of weeks, the parts of your brain that are activated first are the ones that are going to make you think suicidal thoughts when you're in despair because the drug's not working yet to help treat the anxiety or depression or whatever reason you're taking the drug for. It's heart-wrenching. So please be there for your patient, right? Know that they may be thinking these thoughts. Realize this is a medical emergency in the making, and you can save a life literally, sometimes just by listening and just hearing the words and knowing how to react. Okay, well, more clinical, Tom. Okay, well, we know, number one, that these drugs can cause xerostomia. Okay, that's easy. Bruxism, but careful with that word bruxism because it's really not grinding as much as it can be clenching, although it could be both or neither. Some people take these drugs and never clench. Some people only clench and no grind, and some people do both. So important to know why they're using it, okay? And what their side effects may be just by following up with them after they've taken the drug for a while. And of course, you'll see the obvious signs of clenching, and you'll know what does that mean. Problems with TMJ, right? Issues with the joint, as I like to say, right? And overdeveloped masseters and myofascial banding and fractures, cusps and crowns and vertical fractures. And of course, they have xerostomia and they need appliances. Wow, that's a lot. So that is a lot of treatment planning right there, just around one drug. But see, that's why I love you dental people, because I know that's what you're going to do. You're going to treatment plan around all this stuff because you know that that patient can't stop taking that medication. That it's our job to work around it, right? All right, more clinical, Tom. What else? What other things do I need to know? Well, bleeding. What? Yes, SSRIs can interfere with platelet activity, and that could lead to bleeding. Now, how much bleeding is hard to say, right? It's going to depend on also whether or not they're taking other drugs that might precipitate bleeding as well. So if there's an additive bleeding effect there, well, that could be one of the reasons why they bleed more than they should. But just on their own, it's been found that these drugs can interfere with platelet activity and therefore increase the potential for bleeding. What else? Well, two studies so far have indicated that because SSRIs interfere with osteoclastic function and therefore interfere with good bone homeostasis, they could be maybe the cause of poor osseointegration of an implant and therefore early dental implant failure. Folks, it's two studies. There, we could have more data on this. It's really not enough yet. But as I'll mention when we get to gastrointestinal drugs, probably in about 6 years. Just kidding, folks. I'll try to get these out once a month, and we'll keep going as we roll along here. But it's only two studies, and I want you to sort of say to yourself, if I've got a patient that's suffering implant failures, and I don't know why, think outside the box. If they're not taking any of the usual suspect drugs like bisphosphonates or whatever, then it could very well be SSRIs, or as I'll say when I get to gastrointestinal agents, proton pump inhibitors, because think how many people take SSRIs and proton pump inhibitors. That's a lot. So there's a chance, obviously, that that could be the cause of the implant failure as well. Well, that's all I have for you today, my friends, on SSRIs. Please feel free to reach out to me anytime. It's tom@tomviola.com, or check out my website at tomviola.com. But again, much thanks to Jim Lozier and all of the great folks at Digital Dental Notes. I'm so proud and honored to be a part of the team. I look forward to being here with you on a monthly basis, folks, talking about drug classes and pharmacology and the difference that pharmacology can make for you as a dental professional in your daily practice. So thank you very much.